Hello, I'm Rear Admiral Richard Childs, Assistant Surgeon General and Clinical Director of the National Heart, Lung, and Blood Institute, and I'll be presenting the U.S. Public Health Service Awards today. The U.S. Public Health Service traces its roots back to 1798, when President John Adams signed into law the Act for the Relief of Sick and Disabled Seamen, which led to the creation of a network of marine hospitals along with the nation's coastal and inland waterways, including the first marine hospital owned by the federal government at Washington Point in Virginia. For more than 200 years, men and women of the United States Public Health Service have served on the front line of our nation's public health in what is today called the Commission Corps of the U.S. Public Health Service. The Corps represents part of the largest public health service program in the world, and its officers are involved in such areas as healthcare delivery to vulnerable populations, disease control and prevention, biomedical research, food and drug regulation, mental health and drug abuse services, and response efforts for natural and man-made disasters. We are delighted that you're here to celebrate the accomplishment of these Corps officers with us today. First, we have the Distinguished Service Medal, the highest Commission Corps award. It is presented to an officer who has made an exceptional contribution to the mission of the PHS. Achievements to be recognized may range from extraordinary management of a major health program to a heroic act. All recipients have demonstrated an unquestioned devotion to public service through their actions well above the normal call of duty. I'm pleased to recognize Rear Admiral Peter Kilmarks, retired FIC, for a distinguished United States Public Health Service career responding to HIV/AIDS and other infectious disease threats and building health research capacity worldwide from July 1996 to November 2019. Congratulations. Next is the Outstanding Service Medal, which is presented to Commission Corps officers who have demonstrated outstanding continuous leadership in carrying out the mission of the Public Health Service. It is also awarded for those who have performed a single accomplishment which has had a major effect on the health of the nation, or who performed a heroic act resulting in the preservation of life or health. In the Public Health Service Outstanding Service Medal category, today I'm pleased to recognize 11 NIH officers. The first awardee to be recognized is Rear Admiral Timothy Holtz, Office of the Director, for his scientific excellence and outstanding leadership in the conduct of clinical trial in HIV prevention among key populations in Thailand. I'm also pleased to recognize Captain Christine Hunter, Office of the Director, for her exceptional administrative and scientific leadership during extended coverage of the OBSSR Director. I'm also pleased to recognize Captain Jack Yanovsky, NICHD, for his extraordinary research career, resulting in multiple discoveries that have transformed our understanding of obesity. Next, I'm pleased to recognize Captain David Morens, NIAID, for sustained leadership in supporting the director of the National Institute of Allergy and Infectious Diseases, its influenza laboratories, and the national and international scientific community in elucidating scientific, epidemiologic, and clinical factors related to the extremely high fatality of the 1918 influenza pandemic, the deadliest event in recorded human history. Next, I'm happy to recognize Captain Derek Newcomer, Office of the Director, who is the recipient today of 2 Outstanding Service Medals. The first medal is for developing a novel test method to measure capture efficiency of portable air filtration devices used during building construction activity. He's also receiving a second OSM medal for his research exploring occupational exposures to anesthetic agents, which have yielded improved techniques to minimize the risk of illness to healthcare providers. I'm also pleased today to recognize Captain Richard Troiano, NCI, for guiding the full development and release of the Physical Activity Guidelines for Americans, 2nd edition. I'm also pleased to recognize Commander Evan Shukin, OD, who demonstrated a high-quality initiative in leadership and made exceptional contributions to the NIH mission in training over 4,500 individuals. I'm also pleased to recognize Commander Eric Zhao, NIAID, for outstanding leadership in tuberculosis drug and vaccine development to address the urgent global crisis in tuberculosis. I'm also pleased to recognize Commander Joe Pesci, NIAID, for his exemplary leadership in the development and operation of the Prevention Through Active Community Engagement, or PACE program, between 2012 and 2018. I'm also pleased to recognize Commander Leo Gumapas, Office of the Director, for his exemplary leadership in the development and operations of the Prevention Through Active Community Engagement, PACE program, between 2012 and 2018. Lastly, for the OSM category, I am pleased to recognize Lieutenant Commander Martin Godinsky, NIAID, for leadership, innovation, and proficiency in designing and conducting the first in-human clinical trial of an experimental Ebola treatment named MAB 114. Finally, today we have the Outstanding Unit Citation, which is granted to a group of officers who exhibit outstanding contributions towards achieving the goals and objectives of the Corps. To merit this award, the unit must have provided outstanding service, often of national significance. This year, the Outstanding Unit Citation is being awarded to the Reversing the Mortality Rate Group for their work in the nation's drug overdose crisis for the Office of the Assistant Secretary for Health. This group includes Captain Michelle Leff, Captain Paula Na, Captain Jeffrey Schulden, Commander John Hubbard, and Lieutenant Commander Stacy Young, all of NIDA, and Commander Michael Cluck, NCI. Congratulations. In closing, I want to commend the broader actions of the Corps during the COVID pandemic. Thousands of our officers have been called to duty to provide assistance to American citizens, both domestically and internationally. I'm particularly proud of our NIH officers who stepped up to the plate during this unprecedented crisis, with a record number of you deploying over the past 6 months. The sacrifices you and your families have made in your service to this nation are truly extraordinary and are recognized not only by the Corps and NIH leadership, but by the citizens of the United States. As public health service officers and America's health responders, we stand ready to preserve public health and national security during national and global health emergencies. The officers recognized today have exhibited dedication that far exceeds what is expected. All of you have exemplified the United States Public Health Service's core values of leadership, service, integrity, and excellence. It's one of the greatest honors of my life to serve alongside such outstanding men and women. Congratulations to all of those recognized today. I salute you for your service.